Problems with the lines there. Now, 729 people have now died as a result of the Ebola outbreak in West Africa. Yesterday, the head of the World Health Organization, Dr. Margaret Chan, said the disease was spreading more quickly than the efforts to control it. Meanwhile, the United States says 2 American aid workers suffering from the disease will be flown home and treated in isolation next week, the first cases to be treated in the US. Well, with us now is Lisa Denney, who's a research fellow at the Overseas Development Institute, an international development think tank. Thank you very much indeed for coming out to talk to us. I guess it must be a bit of a dilemma for you to decide whether to go out to these countries in Africa to work there.
I mean, there is certainly some risk, you're right, and particularly that's the case for medical workers who are at the front line, which is a bit different in my case where I'm really conducting research. But there are, sources of information with the World Health Organization and obviously the UK government providing sort of good updated advice on whether to go, and at the moment both of them are saying that they're not putting in place travel restrictions.
So what sort of risks would aid workers face?
Well, it depends really where you're going to be based. I mean, if you're going to be based in the capital city and areas not affected, there are health warnings, public health messages going around about making sure that you wash your hands and avoiding some forms of bodily contact. People are stopping sort of shaking hands and things like this. But that's obviously they're much more severe in the particularly affected regions where there are much higher restrictions being put in place.
We're hearing that some airlines are pulling out of countries most affected. Does that seem an overreaction to you then?
I'm not sure that it's an overreaction, but to put that in context, at the moment it seems to be a couple of intra-African airlines, and it hasn't yet been sort of the larger airlines like British Airways or Air France that are putting in place those restrictions.
Can the UK do more to help, do you think?
I mean, I think this latest call from the World Health Organization providing more resources to support more medical staff to go out is important. I think at the moment the sort of limited capacity of the health system in countries like Sierra Leone is what's making this such a difficult virus to contain, and therefore having more support from countries like Britain will be very important in stopping the crisis.
So when you say more support, what do you mean? I mean, what can other countries do to help contain it?
So in part it's more medical staff. I think you have to bear in mind that there are limited trained medical staff in these countries to deal with the crisis, and there have certainly been stories about medical staff who are there at the moment supporting having to work incredibly long hours, which then of course increases the potential for human error and exposure. Then there are also issues around supplies and equipment to make sure that the contamination sites where people are being treated are more effectively resourced.
And looking ahead, what's your view? Do you think it can be contained?
Absolutely, I think it can. I mean, this is, it's a very serious virus, but there have been outbreaks before and they've been able to be contained. Now, certainly they weren't on this scale, but I think the focus now is very much on ramping up support to make sure that we're able to contain this as quickly as possible.
Lisa Denney, many thanks.